So this is a recording of the first chapter notes. It should correspond pretty much with the textbook. The first slide, of course, is the definition. It's the first question on the study sheet. The scientific, systematic study of behavior, experience, and mental life. It reflects the lack of scientific and systematic approach in the early days of psychology. And it also reflects three major schools, behaviorism, psychoanalysis, and humanism, along with the two other schools, cognitive psychology and neuroscience, which is growing. One of the issues surrounding the field of psychology is the fact that it was rooted deeply in the field of philosophy, and it's always been trying to prove itself. If you will, it may have issues, including issues of free will versus determinism, the mind-body dualism, of course, of Descartes, the nature versus nurture dilemma, and of course the whole idea that modern science moves in a reductionistic motion forward. What do psychologists do? Well, as you can see, the largest group of them are clinical and counseling. When taken together, are about 50%, 53% of the entire field of psychology. So they practice. We'll talk about that in a minute. You can notice some other ones on here. Some ones of interest, of course, include research and experimental psychology. It's a low number, but actually it also includes many of the people in the very first item, clinical and counseling. School psychologists work primarily in schools doing psychological testing. Skipping down to gerontology, they work with old people. That number's growing. And of course, pediatric child and adolescent is growing as well. Neuropsychology, I put a question mark there because no one really knows the numbers because so many disciplines are involved in neuroscience research. Health psychology is an interesting field, basically focuses on how people can change their behavior to improve their health, including smoking cessation, diet and exercise, drugs and alcohol, sexually transmitted infections, and of course a perennial problem among primary care doctors, and that's compliance. IO psychologists work in industry to make industry better. They make great money and have nearly zero risk because they're not actually doing clinical work. They're working in industry. Who practices psychology? Well, the broadest term is called a psychotherapist. Psychotherapists do talk therapy. This does not include bartenders or beauticians or hairdressers or barbers. They're trained in the field, and of course, psychologists make up the bulk of that group. To be a psychologist, I think one of the questions on the study sheet is, what does it take to be a psychologist in Illinois? It takes a doctorate in psychology. That can be a PhD, an EDD, or a PsyD. The only difference is in their background, the school of education they are involved in. And secondly, you have to pass the licensing test. So PhDs get their doctorate in the School of Liberal Arts. EDDs get their, like mine, in the School of Education. And PsyDs get theirs in a specialty school, typically a post-master's degree. But all are able to sit for the licensing test. Now, that's not to say that you couldn't sit for the licensing test if you had a social work PhD or perhaps even in medicine, like a psychiatrist. But according to Illinois state law, you have to meet educational requirements in 7 key core areas. Psychiatrists, on the other hand, are physicians by training. They're either allopaths, that's MDs, or osteopaths, at DOs. They pretty much work in inpatient settings and prescribe medications and other medical treatments. The difference between the two is their place of training and residency. Psychoanalysts, of course, are ones that practice, typically they're an MD or a PhD, and they practice psychoanalytic approach. That would be a Freudian approach to mental health care. Mental health therapists make the biggest group of practitioners, far outstripping psychologists in terms of numbers. They have what's called an LCPC degree and have a master's degree. They're not able to call themselves psychologists. They can call themselves licensed counselors or licensed therapists, but not a psychologist. You have to have a PhD in psychology. Social workers, of course, have a degree in social work, and their license in Illinois is called a Licensed Clinical Social Worker, or LCSW. Mental health technicians and counselors work in inpatient settings primarily, whereas mental health therapists work and social workers work in outpatient settings. Nurses, of course, are the backbone of inpatient treatment, and you can call yourself a nurse with a PhD or even all the way down to an associate's degree. One group that wasn't mentioned earlier in my other classes is the music, art, recreation, speech, occupational, and physical therapy. They all provide some sort of allied health professional work, particularly in residential programs. I didn't mention hypnotists either because hypnotists really, there is no licensing nor certification for that. Although most therapists, many therapists I should say, like psychologists, actually use hypnosis as a treatment technique. Just briefly, the history of psychology has 4 periods. The first one is antiquity. No one would identify any of Aristotle, Socrates, or Homer as psychologists, but they're important because they got more modern men to start thinking about free will and mental activity, and basically lay down the foundation for modern education. In the world at the time of antiquity, demonology was practiced, the belief that spirits dominated the world and dominated how people think. One explanation for someone's abnormal behavior, of course, would be possession, and of course the treatment is depossession. Another idea that happened during this time period is called somatogenesis, the belief that abnormal behavior results from a physical cause. This goes all the way back to Hippocrates in 460 to 377 BCE, before the Common Era. He thought that, while this is an interesting idea and there's some support for it today, he believed that when the fluids of the body are out of whack, it causes mental illness. There is no empirical evidence to support this. Psychogenesis, of course, came later, and this was the underpinnings of psychodynamic or psychoanalytic therapy. Basically, the belief that there's something mentally ill with you or something that is out of whack in your psyche. And of course, the most common type of psychoanalytic treatment is hysterical conversion. These typically, by the way, never show up in a psychologist's office, but they do show up in a neurologist's office because many of their symptoms are very similar to other neurological disorders like multiple sclerosis. The second period was called the Dark Ages and Scientific Revolution, and it's characterized by a movement away from the church and more toward a secular society. So instead of explaining things by what some religious group would be talking about, they would do investigations and show, using scientific principles, what was going on. The Dark Ages also included a shift away from treating mental illness and illness in general as a religious imbalance. Monasteries with physicians were replaced by healers, typically monks, and they prayed for the mentally ill. Keep in mind now, this is in the 1500s. Even the medical treatment at the time was pretty meager because there was no germ theory. There was no organized way of treating people. They even sought to rid spirits by persecuting people, burning them at the stake, the persecution of witches. The Pope Innocent VII had a book written called Malleus Maleficarum, which was basically a guide to finding and hunting witches, which, of course, was not true. Many of these people were social malcontents. Over 100,000 people were purged during this time period. And even amongst those people that were purged, very few of them were mentally ill. So the English laws changed to made it impossible or near impossible to, without a due process, to treat or to execute people. People were given their day in court. or they were hospitalized in asylums. When the Renaissance came, this would be the scientific revolution, things really began to change, not only in the field of science, but in the social sciences as well. Asylums were prevalent all over Europe, and they initially were used to treat people who had leprosy, which is a bacterial infection. Most common one was called St. Mary's of Bethlehem in London in the 13th century. The United States had one in the 19th and 20th century called Bellevue Hospital in New York, but it wasn't nearly as gruesome and bizarre of a place as St. Mary's was. Early psychiatry emerged during the scientific revolution, including people you may have heard of like Benjamin Rush, who pioneered the use of things like bloodletting and cold water immersion, which of course aren't done anymore. Philip Pinel in Paris encouraged the humane treatment of people instead of shackling them and putting manacles on them, to untie them and try to treat them with dignity, often reserved for people who had money and could afford it. In England, the moral treatment emerged. It's not moral in the sense of right and wrong, but moral in the sense of trying to do what is unto others as you would have done unto you. So retreats like the York Retreat emphasize peaceful recovery, work, and aesthetics like painting and other types of art modalities. In this country, we had the Hartford Retreat in Hartford, Connecticut in 1824. But the bad news was, the good news was people were being treated humanely. The bad news was only a third of them were getting better. And partly that happened because there was no medical model. The emergence of state hospitals in the United States happened in the 1850s when Dorothea Dix spearheaded the mental health hospital movement. Early classification systems came about. William Geisinger was the first person to identify the connection between a mental illness and a physical cause when he discovered that syphilis was caused by a bacteria. Emil Kraepelin followed quickly with his classification system of schizophrenia and bipolar disorder. At the time, they were called dementia praecox and manic depression. Incidentally, the most current classification system, the DSM-5, Diagnostic and Statistical Manual, has over 500 diagnoses in it. So they've come a long way from that. In 1860, Louis Pasteur discovered that germs can cause disease. So it opened a whole new area of investigation. Psychogenesis, back to that for a minute, also is part of this third period, and it was the reemergence of the idea that some psychic cause is the source of mental illness. So Franz Anton Mesmer believed that it was caused by a magnetic disturbance in the fluids in the body, and of course the treatments were to pass metal bars and ingots over people. It didn't work. He was seen as a charlatan and a quack. Jean Charcot in Paris studied hysteria as well and did some interesting treatments, all of which were debunked at some point. Joseph Brauer believed that all you needed to do to treat hysterias was to let your feelings out. Sounds familiar because Sigmund Freud also believed that. Freud added the addition of having insight into your problems. Incidentally, none of these three techniques work. It wasn't until the modern era that things began to change. So this is one of my favorite periods. The third period is early era of psychology. So there's basically two schools, structuralism and functionalism. Wundt was the very first person to identify himself as a psychologist. He was a biologist by training, used introspection in human studies to uncover underlying problems. It's called structuralism because he believed, much like Newton did, that energy came in corpuscles, but he believed that mind came in corpuscles. So basically, if you could find the structures of the mind, you could understand a person. That was in sharp contrast to William James at Harvard, who was a functionalist. He didn't believe it was the stuff that makes the mind up, but it's the functions that the mind does. So he believed that the brain was a lean, mean adaptation machine. There's this dynamic adaptation process going on all the time. So while Wundt was the first psychologist in the world, he actually changed his nameplate from Department of Biology to Department of Psychology. William James was the first American psychologist, and he developed the first American Psychological Laboratory. Incidentally, James is the founder of essentially the School of Neuroscience. Back in the 1890s, he hypothesized that there was a neural network that the brain is the center of. But we'll talk more about that in the next chapter. Incidentally, during this third period, there were some other fields of study, including psychophysics, comparative psychologies, which would have been psychologists studying animal analogs, and ethologists, which were European psychologists or biologists studying animal analogs, all of which contributed to the basic science of psychology. The fourth school is called modern psychology, and this is where we're at today, or the fourth era, I'm sorry. So it has 5 schools in it. The first one, chronologically, was psychoanalysis, also called psychodynamic theory, founded by Freud in the 1890s. And basically, it's a school that emphasizes unconscious forces, particularly the sex drive and the death drive. We talk more about this in personality psychology if you're interested. The problem with this theory is it's deterministic, so the past determines the present. And the bigger problem is it's not testable. How do you prove that you don't have an unconscious mind, and how do you prove that you do? Unfortunately, this was the foundation for most modern social theory, especially in criminal justice. The second school emerged was called behaviorism, and it was really more of an American phenomenon. And it hit its peak in the 1920s through the 1950s. It basically addressed the idea that all behavior is learned and that humans are a product of the learning environment. Important contributors, other than Ivan Pavlov, who was Russian in 1905, included John Watson in the 1920s and B.F. Skinner in the 1950s. We're going to talk more about these people later when we talk about learning and memory. Unfortunately, while behaviorism can be a very testable theory because you identify processes and can replicate them, it still has this problem of being deterministic. So your learning past, even though you're an adult, determines what you do from childhood, determines what you do as an adult. So a lot of determinism going on here. So the third school is called humanism. And basically it rejects deterministic theory and says people make choices that are behaviors based on free will. And it basically has this idea at its core that all humans are basically good. So again, these are very difficult to test. What the humanists did, though, was they gave us a myriad of psychological techniques to use with patients. Some of the schools of humanism include, of course, humanistic psychology. Probably the most famous American psychologist, bar none, is Carl Rogers, who was not only had a significant impact on humanistic psychology, but on how psychologists did therapy. So in Freud's day, he would sit behind patients and they would talk, and he would write notes and smoke cigars. And when Carl Rogers came along, he came in front of the patient and had a conversation and built a relationship with them. 2 very different processes. It also included probably a person you know or have seen before, Abraham Maslow, and his Pyramid of Needs. Another humanistic school that's lumped in here is called Gestalt psychology. And these were early psychophysicists from especially Germany who wanted to study humans in their natural environment. So they were very anti-reductionistic. If you want to study a chimpanzee, you go to Africa and study it in the wild. And if you've been to a zoo, you realize that chimps don't act the same in captivity that they do in their natural setting. We'll talk more about Gestalt psychologists in sensation and perception. And of course, the last group were the existential psychologists, including Jean Paul Sartre, Viktor Frankl, Soren Kierkegaard, and one of my favorites, Irving Yalom. And basically, they talked about the human predicament, that we all have to deal with things like death and loneliness and isolation. And these are all part of the human condition. The fourth school is called the cognitive school, and it's very closely related to the behavioral school. But instead of emphasizing learning behavior, it emphasizes mental behavior. So early psychologists, behavioral psychologists like Skinner, rejected the whole idea of mental processes because they couldn't prove it. By the 1970s, which is when the school really came to its peak, we were able to verify mental activities with different types of imaging techniques, and it basically presents the idea that humans are lean, mean, thinking machines. And some of the famous psychologists that were cognitively based included Aaron Beck, who studied depression, and a guy named Albert Ellis, who studied kind of maladaptive thinking in humans. The fifth school is called neuroscience, and this is currently where we're at today. And it basically has the assumption that all behavior is rooted in the nervous system. So if we understand the nervous system, we understand why people do what they do. A very mechanistic approach, but growing in popularity.